and I see Dr. Debra Hain is here. We can go ahead and spotlight her, and I would love to introduce you. So Dr. Debra Hain is going to be discussing steps to nurture your mental health for the entire family with us. Dr. Hain has been a nephrology nurse for about 30 years. In addition, she has her PhD in nursing and is an associate professor at Florida Atlantic University at their College of Nursing. I'm super interested in hearing your presentation today, Dr. Hain. I think prioritizing your mental health is so important and that it should be discussed more. So thank you for taking the time to be here today. And I will go ahead and pass it on to you. And we could see your slides, so you're good to go.
Oh, perfect. Perfect. Hello, everybody. I'm really excited to be here today. This is a very important topic for me. In the last year, I became a psychiatric mental health nurse practitioner because of all the issues that I've seen with mental health and people with kidney disease. And so hopefully this will help support you as well as your family in trying to identify things and think about if you need to seek help or what steps you could do. So first, what I've done a lot of CKD education before stage 3, 4, 5, and then I've seen patients on dialysis as a nurse practitioner for many, many years. And as I said, I've been educating since 1995. And one of the things that people may say when they first learn they have kidney disease, I thought my life is over, my life is done. And they may just hear this and think, oh, it's just overwhelming. And that's why it's really important to have early intervention so your nephrology team can work with you to really help you through this journey. As you heard previously from the previous speaker, was about controlling your blood pressure, diabetes, other things to help treat kidney disease. Well, your mental health is just as important. So many emotions can occur. Some patients I've cared for are angry, or some patients, nobody comes in and says, well, I'm glad I have kidney disease, and this should be a wonderful journey. They're very scared. It's something that, what does this mean? And the more advanced stage of kidney disease you have, for example, stage 5, and when you may have to make choices about kidney replacement therapy, it's even more frightening. I've done a study where we did education with people at stage 3, and they really wanted to hear a lot about kidney replacement therapy. And then other people, when they're closer to having to consider that, they don't really want to hear it. It's really overwhelming. And another thing patients have said to me is they thought I was really nice, but they didn't listen to a word I said because they just weren't prepared to hear it because of all these emotions and just being afraid of what their future may be. But I hope after this talk, we'll know that your life is not over and give you some optimistic hope that you'll be able to move forward with a positive life in spite of having kidney disease or having to choose kidney replacement therapy. Some people may even say my life is on hold. And I had a gentleman many, many years ago who worked on the Miccosukee Indian tribe on their reservation. And he came in and he came as a second opinion and was told that he needed to start dialysis. And nobody had told him. The other thing I was told about was hemodialysis. And he said, how am I going to work? I have kids. I have a family. I have to work. I have to live. How am I going to do this? And he didn't know anything about peritoneal dialysis. And so when we discussed that, it was amazing how he just was like, oh my gosh, maybe my life isn't on hold. And so we have to, when you find out that you have kidney disease, it's really important to talk to your provider, to your kidney team, and discover what's best for you. And we'll talk more about that as I go through this. It was a happy story for him because months later, I saw him. He started peritoneal dialysis. And months later, he was so happy. He said, I can't believe that I still can work. And he was getting ready to work towards having a transplant. So there was some hope for him. Nobody wants to be at the point of having kidney disease and having to make those decisions. But our job and as we work together is to really provide that hope for you. Depression is very common. The more advanced kidney disease, the more common it is. It is very common in people with diabetes. It is very common in people with chronic disease, common when people as they age. So when life happens, you can have depressed feelings, and it's particularly common in people receiving dialysis. And so, and even those who receive transplant, we'll talk a little bit more about that. And what are some of those symptoms? But just to be aware that it is a very common condition to have. So some of the signs and symptoms of depression are feeling sad, tearfulness, feeling empty. I've had some patients say, I just don't feel like I have a future. My life is over. There may be angry outbursts. I had a gentleman for a year when he first started dialysis. He didn't have any education prior to starting dialysis. He was very angry. And I just was on the journey with him until about a year later, he said, you know what, I accept this and I'm ready to discuss transplant. Prior to that, he didn't want to do anything. He didn't want to engage in his care. He was just very depressed and very angry that he had to start dialysis. You can have a loss of interest or pleasure in normal activities, sleep disturbances, tiredness, lack of energy, reduced or increased appetite. And you can gain weight or lose weight. And I missed one thing with the sleep disturbance, it can be sleeping too much or not sleeping enough. Anxiety is also very common, and anxiety and depression usually go hand in hand. So it's not uncommon to have anxiety. And I've had patients who get anxiety within an hour of starting their dialysis treatment, they have anxiety and they're very anxious and they want to get off the machine. Their blood pressure goes high and they just can't sit there. It's like a feeling of doom for them. And so that can happen once you're on the treatment, or it can happen anytime. Anything can trigger anxiety. So some of those symptoms of anxiety are feeling nervous or restless, that impending doom. Your heart rate can go up, your breathing can become rapid. You can have a panic attack where you need to just get out of the place where you're at. You just start breathing fast, you hyperventilate, feeling tired or weak, difficulty concentrating, can be some trembling. Everybody is different. Some people have anxiety and they don't have any outward signs of anxiety. They just feel it inside. And sometimes we'll see with those type of people that their blood pressure may go up. We did 24-hour blood pressure monitoring in our practice for many, many years. And what we would do is put a blood pressure cuff on our patients, and they would have their blood pressures monitored for 24 hours. They would keep a diary, and then we would see if their blood pressure went up or down, and depending on what was going on, they could not see their blood pressure reading, because if your blood pressure is a little high and you're anxious, it'll go up higher. If you read it, you take it again because you're anxious, it'll go up higher. That anxiety will increase that blood pressure. And so what we would see is that the patients would have episodes of anxiety-induced hypertension or high blood pressure during that 24 hours. Some of the things that would create anxiety in them were having a discussion at the family table, watching TV, watching the news. Different things can increase your anxiety, driving a car in traffic. So something to be aware of. If you're feeling these things, make sure you're talking to your provider. Many people have post-traumatic stress disorder, and this is where people have those flashbacks. Something triggers that flashback. And so we look at post-PTSD in our veterans when they come back from a war or something that's happened, but other things in our life can trigger that stress disorder. For example, many of the patients I care for that have mental health conditions have been traumatized as a child, whether sexually or physically abused or traumatized in some other way. And that can come back later in our life. We tend to do when we're young or something traumatizing happens to us, we bury it. We bury it down and it will come up sometime in your life in many different ways. And it may be through anxiety, may be through that fear where you have that fear, you see something. When sometimes it can be triggered from smells, from sights, hearing something, it'll bring back that memory. People will often have nightmares at night. They aren't able to sleep well. It is really that hypervigilance and thinking about what it was. It may not be that exact thing. Sometimes we don't remember the exact event that was traumatic, but we'll feel this stress and something triggers it. Some kind of emotion, something through our senses triggers that. And so not only people that come back from a war zone, but those who also experience stress, as I said before. In fact, there's a whole body of literature talking about trauma-informed care. And so that it's really important that we don't re-traumatize people because they've been traumatized in the past. For example, I had a patient one time that was a Native American. And as a child, he had been restrained and beaten. And so whenever he was in the hospital, and if they ever tried to pull up the side rails or put him in any type of restraint or anything that might make him feel that, he would start to act out because it was like re-traumatizing him. So we want to make sure that we're thinking of that many people have lived through trauma, and some things may trigger it, and some behavior may be related to that. So many people, as I said, that are receiving dialysis have advanced kidney disease, have depression and anxiety. So thinking about some things when you're like, for example, if you're on the dialysis machine and you're feeling this anxious, it may be the fact that you have anxiety induced or panic attacks. And what we would often treat patients with, sometimes you need medications. I'm not going to talk a lot about medications in this discussion, but I'm happy to talk about it if anybody's interested. Many people, though, I've given them a selective serotonin reuptake inhibitor, something like Zoloft or Lexapro, you may know, and that helps them. I mean, sometimes it's just a very low dose. I had one woman that had panic attacks about 2 hours into her treatment. I started her on Zoloft, a low dose, and she did very well. So there are medications that we can use to treat depression and anxiety, and often people need both medication and non-pharmacological interventions. So we want to think about, people don't like to take medication. Many of you are already taking a lot, many of you are taking many medications. And so one more medication, but sometimes it's needed to just get you through those rough times. Even in transplant, many patients I had look forward to getting that transplant. They really want that transplant. And they're thinking about, wow, I really would like a transplant. That's my future. But there are a lot of studies that show that even with a transplant, people can experience depression and anxiety. Even though it may be their goal to get that kidney transplant, they may face that. They may face it after they get that transplant. And the suicide rate, people can consider committing suicide because of it. And so it's really important to identify these feelings. I had a patient one time, a young man who got a kidney pancreas transplant, and you think he'd be really happy not to have diabetes anymore and not to be on dialysis. But his whole life had been diabetes and dialysis for many years, and diabetes most of his life. And so he didn't know who he was anymore. He didn't know how to identify, because he no longer was that person that needed to worry about his injections and taking, getting his insulin. So his whole life had changed, and it took him a while to adapt to this new change before he was really ready to accept it. And during that time, he had depression and some anxiety. So you want to, can happen, even if that's our goal, to get to that point of getting that kidney transplant. It is a lot to go through, and there is a team to support you if you are feeling that way. How about home therapies? We talk a lot about home therapies. Peritoneal dialysis, home hemodialysis is now another option. It's a great option, and we're really a major initiative in the United States to start doing these therapies. And so as we look at these therapies and we think about, okay, I'm at home, I'm taking care of myself. How much connection do you have with others other than the nurses or the team from the dialysis center? So you want to make sure you're still connecting with others, you're still able to live your life, you're still able to engage in life, and that this is the right therapy for you. Great option for many, but every option we have has pros and cons. And so when you discuss options with your provider, if you have stage 5 kidney disease or stage 4, and you're thinking about what options I want for kidney replacement therapy, is it going to be home therapy, is in-center hemodialysis, or transplant? You want to think about all these options and what are the pros and cons and what's best for you. And know that during these transition periods, you can feel those anxiety, depression. It's new, it's a change. And even though you're excited to do something, like I said before, getting a transplant, it can be challenging. And there can be days where you feel good and other days when you feel like, oh, I just don't want to do this anymore. It's just overwhelming. And that's when if you have more of those days, it's okay to have some of those days. You're going through a lot, having to manage your medications, having to manage the treatment, family issues if you're working, many things that you have to consider. And You want to, if you're feeling any of these, if you're feeling sad or feeling like you just lost that energy or lose pleasure in things you used to enjoy, or you're not able to do those things you enjoy, and that's causing those feelings of sadness, then you want to talk to somebody, because every day can be different. I had a gentleman one time came in and we did a test called the PHQ-9. Many of you probably have done that already. And it's just a 9-question for depression. And on the day he saw me, the scores didn't indicate depression. Then he saw a neuropsychologist who does other testing. And at that time, it showed that scores that showed he had depression. So I said to him, I said, one day it was okay, and the next time it wasn't. He said, that day I was having a good day. This day I was having a bad day. So we can have those days, but are they more bad than good? Are they causing you some more distress that you can't engage in things you like, or that you can't, that you're not wanting to spend time with family and friends and socialize with people? The worst thing that happened to someone is to not have that social connection. In fact, as we age, social connection becomes a very important predictor of health. So having those connections with people. Sometimes people choose in-center hemodialysis because of that, because they want that connection. So when we think of home therapies, we want to think about care partner burden. And we talk about caregiver burden and other for aging adults in, long-term care, those with dementia, those that with hospice care, or other chronic disease. In nephrology, we call it caregiver, care partner, because they're a partner in care with them. And I like that term much better. But you can be burdened if you're the care partner with caring for someone. In some of the studies that I've looked in caregiver burden, the caregiver and that in particular studies was burdened, but the person experiencing the disease felt bad because they knew that their loved one was burdened, and they didn't want that to happen. I had one gentleman who stopped. He loved doing home therapies. He did home hemodialysis, but he stopped because he knew his wife was too burdened by it. So some signs of care partner burden are feeling burdened or worrying all the time, feeling tired, getting more crabby, frustrated. Sometimes you might snap at somebody, that your loved one, and then you feel guilty because you snapped at them, because you just felt so frustrated, like you just can't do this anymore. And then you get frustrated with your loved one, and then they feel bad, and it just causes all these problems. You're losing interest in things that you used to do, feeling sad, having other complaints, headaches, pain is worse. When someone has depression or feeling this overwhelming burden, they can have the pain that you may have will worsen, and pain can cause it, and pain and depression can make it worse, your pain worse and harder to control. So think about these things if they happen to you as you are a partner with your loved one in trying to address their kidney disease. So things you can do. This is the happy part. I want to make it a happy part at the end of this. So the best thing you could do is first and foremost, and you'll hear me say this again, do not suffer in silence. Do not think you're alone. You are not alone. There's a whole community of people who care about you if you're a person with kidney disease and caring about your family member or your care partner. There are plenty of people to support you. But some other things you can do are taking control of your life. You're the only one that can decide if this is what I want to live. This is how I want to live it. Take control. I've given lectures on talking about the importance of knowing your health condition, knowing how to care for yourself. And as even if you're in a hemodialysis setting in center, you should have your voice heard in what is best for you. Whenever I round on patients, I would tell them that, this is what I'd like to do. What do you think? I bring the medical knowledge in there, but I want you to bring the knowledge about yourself and what you cannot and cannot do. If you feel it's better to do it this way, we'll work on whatever it is. Even in psych, there are some patients that I've diagnosed with bipolar disorder, and they don't want to be on medication. So we work together to try to figure out other ways and come to agreement of what is best for that person. You are all unique individuals. Not one person is the same. No matter if you have the same illness, you are unique. I would always introduce my patients on dialysis and tell people their story. I didn't say, this is Mrs. So-and-so, she has diabetes, hypertension, kidney disease. Most of the people in that room probably have that. Who is Mrs. So-and-so? Mrs. Smith is a mother, has a child, has a job, wants to go to school, wants to get a kidney transplant. The important things are who that person is. I wrote a poem one time for an older gentleman, and because of what he said to me, and it is really, know who I am before you tell me what to do. So let people know who you are and what is best for you. Take control. There are some other things you can do to help you if you're feeling anxious. Medication is one thing, and I could briefly go over that. I don't have a slide on it, but I can go over that. But meditation, mindfulness is a meditation in which you focus on the here and now and the present moment. Sometimes we don't focus on that present moment, and we're thinking about all these things that what's going to happen in the future, what happened in the past, and it's bringing us all together to that present moment, but we don't stay there. Stay in that present moment. Take your time and close your eyes. What I tell my 3-year-old grandson is, be in your happy place. Find a place that brings you peace and feeling good. If it's the beach, if it's walking in the woods, if it's being with your family, whatever makes you happy, close your eyes and visualize and feel that. And then take these deep breaths in and hold them for a minute and then blow them out slowly and just calm your mind. Don't if you think of other things, try to just come back to calming your mind. You don't have to worry if you bring something else in your mind, but trying to be very mindful in the moment to just calm yourself, because it can reset all those chemicals in your brain and help you to just think straight. And sometimes you get angry, and it's just taking those moments to just take a deep breath, take those deep breaths and really feeling in the moment and being mindful of what you're going to do next. One of the major things to do that's important for brain health, for heart health, for kidney health, for mental health is physical activity. I don't put exercise in here because I'm not talking about you. If you go to the gym, that's great. If you go and you do regular exercise, that's wonderful. But if you're not that kind of a person who wants to, just get up and walk. Walking has so many benefits. Just taking that time during the day to just get up and walk. If you can't walk outside because in the winter it may be cold, going somewhere where the mall, somewhere inside where you can walk. But walking is such an important activity. The worst thing you can do for your body is to just sit a sedentary life. Not that watching TV is a no-brainer. So, you don't just sit and watch TV. I've worked with people with cognitive impairment for many, many years. And one of the things I tell them is you have to get up and move. It's better for arthritis. It's better for all health. It's we have had so many studies on this that prove the benefit of physical activity. If you feel like you're not very active now and you want to be more active, then start slow. Make yourself a goal. Maybe your goal is by 2 weeks to be able to walk around the block. Maybe it's simple as just the first day getting to the door and out on the front porch. Make goals that work for you. It's not somebody else sitting there. It's you. So get up and move. The more you do it and you create a habit, you'll just do it automatically. Surround yourself with friends and peers. So important to have that. I know some people are very extrovert, and they want to be with everybody, and that others are more introvert. But even if you're an introvert, it's much better for your brain to be with people that you care about and be with your peers, support groups, coming to things like this today, hearing things, how to promote your health. If you see people who aren't engaging, maybe you will help them to engage. Maybe you'll say, hey, maybe we could go to lunch together or something. Do something, join. And if you see other people who are not, try to get them involved, because it's really very, very important for your mental health. Consider the other things you enjoy. If you like to crochet, if you like to read, listen to music. Music is actually really good for your brain. Listening to things you like to listen to, having headphones on, taking a time to just sit and listen to music is wonderful. Things that you like. When I talk to people about dementia, I always tell them, you have to do some cognitive stimulation activities. And that can be crossword puzzles, playing cards, playing video games, doing things, but you have to enjoy them. I don't like to play cards. So for me, I wouldn't enjoy that. But if you enjoy it, do those things, make them. I had a patient of mine one time, she was on home hemodialysis, and she said to me, I just want Thursday off. I don't want Thursdays my day. I'm not going to the doctors. I'm not going to have dialysis. I'm going to say I'm not a patient on Thursdays. I'm going to lunch with my daughter. I'm going to enjoy my life on Thursday and forget. I'm going to take my medicines, but I'm going to forget about everything else. And I'm going to be a person that's enjoying life. That worked for her. So finding things that you like to do. Volunteering sometimes is really volunteering. I love volunteering. It gives me such great happiness. People are generally so happy, so gracious that you did this. You meet other people, you can talk to other people. I think if you're living with kidney disease or you're a family member or care partner, sometimes volunteering to really talk to others that are experiencing this. We have a strong volunteer program at our Memory and Wellness Center, and they help people that are going through this. They've lived through it, and you, if you live through it, you've got great suggestions. So volunteering to help those, and if it's not with kidney disease, some other volunteering. If it's animals you love, kids that you love, other people, older adults that you want to be around, volunteering is a great opportunity to feel better and have and connect socially, feeling great about what you're doing, and you reap the benefits. Even though you don't get monetary, the benefits are much greater than that. You're lucky enough to have a pet. They are so therapeutic for you. Pets are great. They can make you, they love you no matter what. And so having a pet can really just come home to a pet or be there with a pet, if that's an option for you, is always a great opportunity. The pets can just be make you feel so much better if you love animals. So consider that as an option to feel better. Eating healthy. So some things when I don't like to use the word diet, but I've got it in here because that's the way they came up. But the DASH diet, maybe before you're on dialysis, where you have low sodium, finding ways that you can prepare foods, learning how to prepare foods. The plant-based diet is actually shown to help with inflammation. One of the things we know with depression and anxiety is that there's inflammation. And we also know there's inflammation with kidney disease, diabetes, high blood pressure. So doing a plant-based diet is good, and carbohydrate counting, particularly if you have diabetes. But I also believe that if there's certain things you enjoy doing or eating, that's really important to do that. I have a person that one of my patients, he said, "Oh, I'm so afraid to go out to eat. I don't eat anything. I just stay home and eat. I don't go out with my friends anymore. I used to go out with my friends, and I don't go out with my friends anymore." That's the worst thing that can happen, is that you don't go out if you used to like to go with your friends to eat dinner. There are more options nowadays. There are several restaurants that have plant-based diets, if that's what you're eating. You have to be careful with the sodium, but if you feel there's something you really want, I tell people take a little bit of it and enjoy a little bit so you don't desire that food. I had a patient of mine said, no matter what I'm going to eat, he was on dialysis. He said, no matter what I'm going to eat, I like to go for my spaghetti dinner once a week with my friends, and I'm going to do it. I don't care what's in it. So I said, well, let's choose a day of the week that you're going to be the safest. Let's pick a day that potassium, that you're getting dialysis, not a Friday, and you're waiting until Monday, say, for dialysis. And talking to, if you're on dialysis or have had a transplant, and some CKD clinics have access to a dietitian, talk to the dietitian about what you can eat, finding what you like to eat and not being so restricted. I did a study one time where one of the themes of it was living a restricted life, and nutrition, diet was one of those things. If we really like something and we really want it, maybe a small portion of it would be okay. And that's something you should discuss with your provider. If you have access to a renal dietitian, that's wonderful because they're so knowledgeable. So using our resources that are available to us. Ways to cope as for patients and their families. As a patient, be active in your care, as I said. Is you feel free, discuss with your family. Try to discuss with your care providers, the providers in the dialysis that you want, or on transplant or CKD. what you want, what your goals are in life and what you'd like to do, and making sure that you can try to fit some of these things in. When in my studies, I had patients that said, the only reason I want to be on dialysis is to see my grandchildren graduate from preschool, and that may be all you want, and you're happy with that, or to spend time with your grandchildren. That may be what you want to be able to do. Whatever you want to do, let's just really trying to find time for that. Don't miss any of your treatments if you can, and getting adequate dialysis is really very important if you're on dialysis. Know your medications. If you have CKD, or if you're on dialysis or transplant, know what they are and know why you're taking them. Pay attention to those signs of depression. Use your dialysis time wisely. When you're there, many patients will bring in a iPad and read and do other things when they're there. I've had some conduct business when they're on dialysis, doing things that you feel are helpful for you. Eating the foods that are appropriate for you, and trying to get adequate sleep. Sleep is such an important part of our health. You may have to have psychotherapy or family therapy. You may have to have individual therapy. You can choose that. There's many different types of family therapy. It's really talk therapy that focuses on improvement among family members, and also can be used to treat mental health disorders, can be for many reasons. But family therapy can be very helpful. There are different types. I'm not going to go through those different types, but if you can find a therapist, it's really important to try to consider that. You may want to have psychotherapy where you're actually doing some talk therapy. There are some different types of therapy. For example, EMDR, which is what Prince Harry did, and that was from post-traumatic stress disorder. You may be cognitive behavioral therapy, where what you're doing is you're thinking of any of those negative thoughts, we change them to a positive. And I'll talk a few minutes more about that. I think it's really, really important to think about therapy. And then if you need medication, many times we need medication to go along with it, just to get through those rough times. Sometimes we need the medication for the rest of our life, but sometimes just during that transition. And then along with therapy, learning how to live your life the best you can on dialysis or having kidney disease. I talked about caregiver partner burden already. To prevent that, ask for help. Give yourself permission to take a break. Take care of yourself. Find time for yourself, doing something you like, making a list of your daily activities and tasks. And then as you complete them, completing them at a time that won't interfere with what you're helping with. You can check into family leave benefits. And if there's an opportunity to get away if you can. Have someone there to support your loved one. If you're on home therapies, perhaps your loved one can go with. What I find with caregivers, care partners, is they don't want to ask for help, particularly older adults, because they don't want to burden their children. But it's so important that when you're feeling the stress of being a care partner, that you find someone to help. Receive therapy. If in a dialysis center, we have social workers. Find the help you need, because it is not abnormal to feel overburdened. You may love that person so much, and this is what you want to do for them, but you're going to be you really can feel that way because it takes a lot. It's a lot of responsibility. So adolescent, I just wanted to bring this in, just the populations type. The adolescent depression is on the rise now, and so if you're a young adult, a adolescent with kidney disease, your life can be very challenging, because as in adolescence, we want acceptance of our peers. We want to be part of a group. We want to be part of a social engagement. And then we have this disease. I had one young man that he had stage 5 kidney disease, was getting closer to needing dialysis. We were hoping to do a preemptive transplant. And his poor mother came in and she said, he wants to eat pizza with his friends. I can't let him eat pizza with his friends. And I said, yes, you can. Let's work through this, because he's going to do it no matter what. He's going to eat the pizza because he wants to be with his peers, and he doesn't want them to know that he has kidney disease. I had a patient one time that said, I don't want to take my binders because I don't want people to know I have kidney disease. So we found a way that she could take her binders with food and not let people know that she has it. So but depression is very high in adolescents right now. And suicide rate is also increasing in this population. So being aware that depression can occur and addressing it early by getting therapy, finding a healthcare provider to help, identify and treat is really important. If you start seeing the adolescent isolate themselves, really not communicating with others, not going out and doing things they like to do, doing poorly in school, not wanting to go to school, those could be warning signs that that person is experiencing depression. Older adults in depression, it's very common for older adults to have depression. And sometimes that depression can be just seen as, I've had patients come in that think they have a cognitive impairment like dementia, and they have depression. And once we treat it, they return to their baseline. So it's that similar signs and symptoms of depression that I reported earlier. But one of the major ones that we see is not wanting to engage in activities that they used to do, and being more forgetful, decreased concentration. So very important, because older people, definitely depression is prevalent in that population. And if you consider having a chronic disease, it's even higher. As I said earlier, we have social workers in our dialysis centers and in our transplant. Some in CKD clinics may be fortunate to have a social worker. They're trained in how to address and assess for mental health. If you're not able to do that or don't want to feel comfortable, finding a mental health provider is really very important. And there are more and more online mental health providers where you can do it through telehealth, so it won't be a burden if you're already having to manage your chronic disease. Most important, it's what matters most to you, what you think is most important to you in helping to achieve those goals. If you're feeling depressed or have anxiety, what are our goals? Every time I see a client at the end of my session for mental health, I say, what are our goals? What are the goals of therapy? What are the goals that you have? What are your future hopes and dreams? Where do you want to be in the future? A transplant? Living long enough to be with your grandchildren, getting married. I had one patient who just wanted to get married and have a child, and that happened for him. He was able to adopt. So let's work together. It's not just about having a chronic disease. It's about living your life. And that's why I don't use the word dialysis patient, kidney patient. It's a person living with. You're living with this disease if you have it. If your family members there, they're with you. And we want to make sure that we support you as a kidney community and that you are able to achieve the goals that you have. Maybe going to school. A young man who went to the gym every day, wanted a transplant because he wants to he wanted to go to school. He had goals. That's our goal. What we need to work towards is what is important to you. Take control. Let us know, please. So I didn't know if anybody had questions, and I thought this would be, I see some in the chat. I don't know if anything in here is for me. Does anybody want to let me know if there's questions?
Yeah, Dr. Hain, I can filter the questions to you. Thank you so much for your presentation. That was great. We do have a question from Caressa. She's asking, what is behind people not wanting others to know they have an illness? Why don't they want people to know they have a chronic disease?
A lot of times they don't want to know for a couple reasons. One is stigma. Particularly, let's say you have a job and you're working, and then they might think, well, you can't do your job. That's not true that you can't, but they may think that. Other is that they don't want people to tell them what to do. They don't want people to feel sorry for them. Every patient I have empathy for them, but I don't feel sorry for persons. And many people don't want that. They don't want pity. They want understanding. So a lot of people just don't want to do it because I think the biggest reason is stigma. And what they think, oh, well, you got this disease, you can't do that. Oh my gosh, you poor thing. How could you live like this? That's probably the major reason for people not wanting to tell others, because they just don't want people to know their business. Plus, they don't want to hear this sympathy. Oh, you poor thing. I don't wish anybody to have kidney disease. I don't wish anybody to have diabetes, hypertension, any of this. But I also am not going to feel sorry for you. I'm going to walk with you on this journey and be present with you to say, where are we going? Let's, what your goals are. But people, I think the biggest part is stigma and fear. People when I would talk to people about kidney disease, they were fearful that their life was going to change so much when they started dialysis or got a transplant that they would no longer would have that same life. And yes, it's going to change, but we have to decide, the person has to decide with the care team of how that will be redefined in that person's life. I hope that answered your question.
Yeah, that was a great answer. Thank you. And speaking of the stigma, I mean, I have a question for you. I feel like, the negative stigma surrounding mental health is still, super prevalent today. Do you have any advice for people whose family or support system maybe don't prioritize or understand mental health struggles, and like how can they go about talking to them about any challenges they might be experiencing?
Absolutely. So when, the worst thing you can tell somebody is get over it, it's not that bad. We all experience it differently. We all experience our mental health issues, our chronic disease differently. We're all, as I said before, unique. So everybody listening to that person, listening to them and talking to them, if you find that they are make sure it's confidential. If you see someone that you think may be feeling depressed or having anxiety or some other mental health, PTSD, some other mental, I didn't go, there's a lot of mental health disorders. I didn't go through all of them. It would take too long. But if you feel that you see somebody, have a conversation with them privately, and not using cliches like, oh, well, my friend had it and they did this and they're better. Talk about that person, tell me what's going on and what can we do to support you. And then sometimes you're going to have to suggest that someone see a mental health provider. There is such stigma. And the other thing is we have a shortage of mental health providers. So there's a lot of stigma with it. And we don't want to, and some people want to say, well, I'm a man, I should be strong, I shouldn't feel this way. If you feel that way, it's okay. I mean, but at reaching out, and if you find somebody having that conversation, if you don't think you're the right person, maybe it's going to be a pastor at a church. Maybe it's going to be the physician or nurse practitioner, PA that you're seeing. Bring it to their attention. I've had patients say, I think my mom's depressed. So then I have that conversation and take the family member out of that so they don't have to be in the middle of it, but have that conversation with them. So if you feel that person may be struggling with something, have that conversation with the healthcare team and telling them, I think something's going on, and they should have the ability, if it's in dialysis, the social worker should be able to talk to them. And maybe we need further as a mental health provider outside of the kidney community. And that's the conversation they can have with that person. I see that look like you're feeling a little sad. 2 questions you can ask someone, and are you feeling sad or blue? Sometimes people won't acknowledge the word depression. So saying, do you feel sad or blue? And then, have you lost interest in things you usually enjoy? So sometimes people will avoid they'll deny, so that they just don't want to face that. It's scary for them, can be fearful for them. They can be fearful, or it can be that stigma. So just trying to have a quiet conversation, not saying, things like, yeah, that's not that bad. Whatever that person's feeling, getting some professional help is probably the best thing.
Thank you. And so we just have one more question, and then we'll conclude. Lisa wants to know, what should we ask legislators to do in order to help patients with mental health issues connected with CKD?
Oh, I think we have to advocate for more support, financial support, reimbursement for people, because and also so we can have more providers, because there's a shortage of providers, particularly for people. One of the things are in a nephrology community, for those that are CKD, you may have depression or anxiety or some other mental health disorder, and we don't have enough providers. I've had my colleagues say to me, where are we going to send people? There's just now, and there's waiting lists. I have somebody, friend of mine just wanted to see a mental health provider, and she has to wait 6 months. So advocating for more legislation that we will reimburse, and to keep telehealth, because there's legislative wise there is stopping some of that reimbursement for telehealth. We really need that because many people that are working prefer to do it through telehealth. Some people want to face to face, but if we can at least do it in these rural areas, if you can't get face to face with a mental health provider, having that in the having telehealth is a great way. I would love to see a model where mental health providers are included in that kidney care team, because I think it's such a prevalent problem, healthcare problem, that we really need the team to work together. But there's just not enough. So having the funding towards it, the reimbursement, I think would be an important thing.
Well, thank you so much, Dr. Hain. That was a fantastic presentation, and thank you for taking the time to answer those questions.
I just wanted to say thank you so much. You've been doing this a long time, and it always seems like we're going to have a shortage of resources. I really try to encourage people. You have to have something you love to do, and you have to take your body, and sometimes your mind follows. Like, I always have an art project out on the table, something that I can take myself away to cope. You have to develop your own coping skills, and it's work.
Yeah,
it's the most important thing. It's coping skills, and I think some of the most therapeutic things somebody can do for you is just to come over and hang out with you. And
I see someone who's feeling like that.
Yes, simple.
Yeah. Just to call you and say, hey, I would love, would you like me to come over? Or would you like to get together, have coffee? Or would you like to get together just to go talk or something? Because isolation is only going to make the depression, the sadness worse. And so it's not an easy place for everybody to be. But like you said, take control, determine your journey. Don't let this take you down, and you have to develop, as you said, coping skills, ways that there are things that are important to you and activities that are important to you. Don't let the disease guide you, guide yourself. You be in control.
And then one follow-up thing, and I think it's so important, is I love to hear other people's problems when I don't feel good. I'm sorry. I like to realize, I like them to share them with me. And oftentimes people are like, well, I didn't want to burden you because you're not. And I'm like, actually, that makes me feel better that, other people have problems and, I'm part of the discussion. And I think people like put us in a box sometimes, like, oh, she's fragile or whatever. And that just adds to the loneliness. Like you're not part of a community, and we're so isolated. I mean, you know me for almost 30 years, I think. And that has been my number one mission. One friend makes a difference in this illness. And I'm encouraging people to reach out, find somebody you have something in common with, and ask them for lunch. Be that person that takes the initiative. And it's just so important.
It's very important. And as you said, I don't think we should feel sorry for each other, but be there, have empathy, understanding, and be there for each other. Because you're right, support is so important. Pity doesn't get anybody anywhere. I've worked, as you said, for a long time in this area, and I've seen some really people that have struggled with many things, but one thing that kept them going, survival, was they're determined to survive. Mm-hmm. Was a determination to do things that they wanted to enjoy, and it really, the mind is a powerful thing. So when you give up, your body will give up. So just thinking, even though you may be going through or struggling with something, and that's when you really need to be around somebody that loves you and cares about you.
And you need to feel valued. You really need to feel valued. And I think, I don't know, I just want to ask your opinion on this before we wrap up, but do you think talking is better than texting?
Yeah, I think talking,
people relying on texting all the time. And I just feel so much is lost. I mean, it's a good avenue, but just to pick up the phone and talk to somebody. Yeah. I mean, we're humans. We we speak, we have a voice. So
yeah, sometimes when you text someone, it's easy to say no. When you talk to them and say, "Oh, I'm on my way over. I'm picking you up to go get lunch," then that's different than if you text and say, "Would you like to go to lunch?" No, I don't feel like leaving the house. That's not, really trying to talk to someone is, I think talk is very important. When people come, when I first do therapy with them, they sit for a good hour and just talk, and I just let them talk for the first time. They have so many things they've lived through that they just want someone to listen, and hear what they have to say. And then we work on what the solutions are. But sometimes we just need someone to listen to us and hear us.
mm-hmm.
And care enough to listen, care enough to be there.
Right.
So
well,
yeah.
thank you.
Yes, I wish everybody the best, and thank you. Lori, I love you. So, I hold you up, and you're one of those people who take control, and you've determined to survive, and that's why you're still here. So, thank you for all you do.
Still kicking. I actually thought I was a cockroach over the summer, but anyways, I'm still here.
Yeah, well, we can have those down times, don't we? It doesn't mean we're going to be up all the time.
I know.
We got to find a way to crawl up out of that.
It is. I know. It's kind of a thing, but once you survive so many things, anything's possible that's listening. I mean, I'm like, it's so interesting when you have kidney disease, you can look like death warmed over, and then the next day look fine. That's what's miraculous about it. The kidneys, and they get, them all working and doing everything. And then, it's, anyways, that's another topic, but thank you so much. We're going to do some drawings here. And we got some good things to give away. Gigi, I'm going
to hang up. Goodbye, everybody. I wish you all the best.
All right. Thank you so much. And a shout out to our corporate mission partners for making this happen.